All right, well, I think we'll go ahead and get started here today. Good morning or good afternoon as we get going here on the in Eastern time. My name is Dr. Jim Borchers, and I'm the president and CEO of the U.S. Council for Athletes' Health. I want to welcome you today to our roundtable discussion focused on athletic training shortages and retention and how those issues factor into the overall athletic healthcare model. This discussion is the first in what our USCA team has planned as an ongoing series of discussions focused on reimagining athletic medicine and student athlete health and welfare in 2022 and beyond. Of the more than 500 individuals participating in this discussion, 70% declared in their registration that their institution is currently facing athletic healthcare staffing issues. If you are among them, know that you are not alone, and also know that while we at USCA may not have all the answers, we do have potential solutions that can be adapted to meet the needs of your respective institutions. Before we dive into the topic today, I need to review just a few quick housekeeping items with you. We've opted today because of the number of participants to disable the Q&A function for this discussion, as we expect there to be far more questions than we can answer during this time, while also keeping the discussion on course. After the discussion, however, I urge you to submit your outstanding questions, and a team member will reach out to you to arrange a discussion. For athletic trainers looking to obtain CEUs, your certificate can be downloaded via the email sent from info@USCA approximately 90 minutes after the webinar, and a playback of this webinar will also be made available to all who registered. And now, as we get ready to get started, I'm honored to introduce to you the members of our USCA staff taking part in our discussion today. Dr. Chad Asplund will moderate our discussion today, and he is the executive director of USCA, as well as a sports medicine physician and professor of family medicine and orthopedics at the Medical College of Georgia. Chad currently serves as the medical director for USA Basketball and a team physician for USA Hockey, USA Triathlon, and Georgia Southern University. Angie Beisner is with us today, and Angie is a senior director at USCA, working directly with our valued partners as a reliable resource for innovative solutions, first-class resources, and collaboration. She spent more than 2 decades as a collegiate athletic trainer, serving as the head athletic trainer at Ohio State University prior to joining USCA. Angie has also previously served as a lead athletic trainer for the USA Under-19 men's lacrosse team. Rae Everson is a USCA senior associate and specializes in content development, educational programming, and policy production. She has more than a decade of experience as an athletic trainer with additional certifications in performance enhancement training, corrective exercise, and DEI in the workplace. Rae is a former Division I field hockey player and one of 3 former student athletes on our current staff. And finally, today we have Bob Sweeney with us. Bob is vice president at USCA, focusing on client and partner engagement. He works closely with our 9 NCAA conference partners, as well as our association-wide relationships with the NJCAA and the NAIA and multiple individual partners. Bob previously spent more than 20 years as a collegiate athletic trainer and later associate director of sports medicine within a healthcare system. As I mentioned today, my name is Jim Borchers, and on behalf of USCA, I hope you enjoyed today's discussion on healthcare model updates with a focus on athletic training. And now I want to turn it over to our moderator, Dr. Chad Asplund. Chad?
Thanks so much, Jim. It's a pleasure to be here with our team and to talk about such a timely topic. It's amazing that we've got 250 plus folks, many who I see that are from our conference partners, as well as our organizational partners, and many folks, friends of mine, and I'm sure friends of ours from the business. Today's topic, we're going to really cover reimagining healthcare. We've had many discussions within the USCA team about the way healthcare in athletics works and why it may need to be changed. And I think today, or certainly this time in our evolution, is really clear that it is time for a change in athletic healthcare. I'll start out with Bob Sweeney. And Bob, how did we get to this situation, and kind of why are we at a point where we need to reimagine or consider reimagining how we do athletic medicine?
Yeah, thanks, Chad, and good afternoon, everybody, and thank you for joining us. I think probably here at USCA, we started to notice maybe back in the spring that a lot of our colleagues were leaving the profession. I think that as things started to open back up with last year's sports season and some of the some of the things that were brought on by COVID and trying to get student athletes back on the field, really probably caused, again, a lot of our colleagues to maybe look at their current situation and potentially make a change, which is not all that uncommon at the end of a school year. What was uncommon is maybe the lack or the fewer resumes that were coming in for those positions. It really used to be that if you left a job, especially in the college setting, there were plenty of people who were willing to, to succeed you in that position. So, and really a lot of our partners started reaching out in the fall as they were having difficulty in replacing their athletic trainers that had left. I think a lot of us are on a number of listservs where we look at some of the jobs that were open at the beginning of the fall semester that continue to be open now. And we really started to, again, both from what we were hearing from our partners and from what we were seeing ourselves, realize that maybe this wasn't going to be the replenishment of transitional or entry level athletic trainers into the field that we had seen in years past. So we started working here with our partners and globally on okay, let's find out what's going on and let's hopefully try to provide some solutions for our partners.
Thanks, Bob. Angie, what are some of the reasons that athletic trainers have been stating or have you may think that are causing people either to leave the profession or to not sort of stay in their current position?
Thanks. Well, welcome everybody to our webinar today. I think I'll echo a little bit of what Bob said, but I think the easiest way to explain it is that we currently have a structure set up from the 1990s with 2021 expectations. And I think that it's just a model that hasn't really evolved. The responsibilities, the additional risk to the healthcare providers, those things have evolved, but the structure in general hasn't. I liken it to a marketing department in an athletic department. If you still function the way you did in 1990 and 2021 as an athletic department, you're definitely not getting the exposure by utilizing the social media and all the things that you should to put your athletic department at the top of the game. However, as athletic medicine, we tend to continue to do the same thing over and over again because that's all we've known. So as coaches, administrators, healthcare professionals, we've kind of been trained in one system. We continue to work in one system. That's what we're comfortable with versus other professions that maybe have worked out outside within a different healthcare model or healthcare system. So I think the biggest challenge is that for athletic trainers, the job responsibilities and expectations have simply changed. And as they changed, you've added on to their responsibilities without changing how you do things and providing additional support. So I think that's probably the biggest challenge that I'm seeing or I'm hearing now is that the expectation of a healthcare professional in an athletic department, whether it's high school, college, or clinic, has changed, but the model around it, surrounding it for support has not.
Those are great points, Angie. I like to think of it kind of as, when you go to the doctor's office, there are multiple different people that you interact with. You check in with a receptionist. There's someone who takes your vital signs and puts you in the room. Then you see the content area expert, whether that's the doctor or the nurse. And then you go to, say, checkout or someone to help you make your follow-on appointments. And all along that process, there are people that are best equipped to do that job, where it seems in that old athletic trainer model, the athletic trainer has all of those jobs in addition to being the subject matter expert on athlete healthcare. I'd like to bring Dr. Borchers in quick and just kind of talk about thinking about athletic medicine as healthcare rather than administration or just kind of the way we've always done it. Dr. Borchers?
Yeah, no, thanks, Chad. I think this is a really timely discussion because I think we've seen a lot of things in athletics at lots of different levels changing. And I think the reason that we titled this series Reimagining Athletic Healthcare in 2022 and beyond is because we have to continue to evolve and we have to think about evolving, whether that means that we look at the organization as a whole, whether that means we look at how the organization is providing healthcare, and we look at the personnel that are involved and what their accountability is to healthcare. I think we also have to look at the consumer and the student athlete in that process and what that student athlete comes equipped with today and what their expectations are. And what are we transparent about, as far as what they should expect when they come into that environment. And are we creating an environment where they are, learning the skill set to be their own healthcare advocate? And so I think there's a greater conversation that we're having that obviously influences the personnel, it influences the practices, but it clearly is something that we need to evolve with. And I think we see this in healthcare quite frequently. I've used a number of examples in the past and I think, there's some simple examples like, when you used to see patients in a traditional healthcare setting, you used to always bring the patient into the office to do everything. Well, we certainly know that that's not the case now. And in fact, much of the healthcare that happens in what we call remote patient monitoring now, where we've changed our practice, even how we document has changed, how we do different things. And so we evolve. And if we fail to evolve, then it's possible that we will fail overall. And I think that idea helps us to open the conversation about being comfortable talking about what that evolution may look like and how we can introduce different ideas, different solutions to these issues, not only to improve the opportunities for the people providing the healthcare, the opportunities for the organization, the opportunities for the other people that are involved, administrators and coaches, but really the way we affect what goes on with the student athlete for example, in the college setting. So I think we have to think about all of that. But I think that as we think about reimagining this, just as we're reimagining a lot that goes on in athletics, we have to be open to those ideas and be willing to have conversations about them. And those things are not always comfortable.
Thanks, Dr. Borchers. Rae, what are some ways or some things that we can think about a little bit differently, or how do we start the conversation of moving people towards changing a model or changing the way we've done things?
I think the biggest thing is for everyone to be open to change. Right now, as everyone has already stated, we work in a model that is a little antiquated and hasn't really kept up with the times and the changes of not only medicine, but also what student athletes expect. So some of these things some of these conversations just start with a simple question. An administrator potentially going to the athletic training staff and asking like, hey, what can we do to help change your current situation, or what resources do you need, or what are different tasks or responsibilities that we could take off your plate that normally wouldn't be on your plate as a healthcare professional in different settings. Because if you talk to any athletic trainer, probably at any level, there are a lot of things that athletic trainers are doing that aren't necessarily healthcare related. But again, with athletic trainers, we're typically people who are always there to help. We want what's best for our athletes. So sometimes we become a little overloaded. And we have to constantly come back to, we are there for student athlete health and safety. And if we're constantly being pulled in different directions, that might not actually work out to be what's best for the athlete. So in my opinion, starting with just having simple conversations, laying out the groundwork as to what are some different areas that we need to tackle, and then going from there. And then as you start to make some of those changes, which we'll probably obviously discuss on this conversation, you'll actually start to see things change within your department as well, to make not only the work-life balance of your athletic trainers better, but also to help your student athletes take some responsibility for their healthcare as well.
Those are great points, Rae. I think, within departments of athletics, your athletic director sets the tone and the culture and the expectations. And so it's really important that, from the athletic director down, administrators, that there is an open area for communication, and that there is a culture of health and safety, or a culture of safe communication, if you will. But I know those can be difficult conversations to have, from athletic trainers to coaches, athletic trainers to administrators. Bob, you've been around in the industry for a while. How would you sort of think about framing those conversations, or even approaching some of those things with your athletic administrator or your athletic director, kind of to get the conversation started?
Yeah, I think it's very important for the athletic medicine staff and the administrative staff to really sit down and really look at the athletic trainers' duties as they are currently, and really, like Rae said, how much is this? How much of this is really healthcare? How much of this is really risk mitigation versus either the way we've always done things or things to help out the team or the coaching staff. So I think that's probably a good place to start. And I think another place to start and really where a lot of the concern from some of our athletic administrator partners is where is your exposure in some of this? We have talked to countless athletic trainers, throughout this process of getting information for this webinar. And one of the things that we hear on and on is they're concerned about their own documentation, that they simply don't have the time or sometimes resources to document properly. And so, that is for us a huge area of exposure. We see it on some of our some of our assessments and on our on-campus visits that there is a concern or a lacking in the area of documentation. I think when you're looking at the increased needs for the ability to provide healthcare at practice, governing bodies are upping that with each new paper that they put out. That's a strain on the system as well, and it's really not even so much the hours in the day. It's really having the people available to do it, or having the plan to get everything properly managed while still taking care of the influx of athletes that are coming into the athletic training facility.